Jersey Central with Bert Baron on the new Talk Radio 1450 WCTC.
Healthcare providers at the Jersey Shore Medical Center gather with WCTC's Bert Baron for a Do No Harm Drug Symposium discussing the dangers both legally and medically of opiate addiction.
I'm very pleased to serve as the moderator today here for this very special event. Now my pleasure to introduce our next guest, Assemblywoman Mary Pat Angelini. Assemblywoman Angelini sits on the Health and Senior Service Committee as well as the Human Services Committee, and she's also the Deputy Conference Leader. Mary Pat is the CEO of Preferred Behavioral Health Group, which oversees Prevention First, the Monmouth County Substance Abuse Prevention Organization. Assemblywoman?
It's a sad time, as you heard earlier. We are losing our young people, and I have looked into the eyes of so many parents, most recently, who have lost their child to a heroin overdose.
I'd like to introduce the acting prosecutor in Monmouth County, Mr. Christopher Remiccioni.
So while homicides get a lot of attention, what's really killing people across this county, in this county, our citizens, is heroin and opiates addiction.
The introduction, my name is Dennis Mihalopoulos. Again, I'm the Assistant Special Agent in charge at DEA New Jersey, and I'm also the Acting Diversion Program Manager. What a lot of folks outside this room don't know is that DEA, in addition to having the criminal functions to enforce the nation's drug laws, we also handle the regulatory side with anybody.
Moving along, let's introduce our next speaker, NJPMP Administrator James Maiello, New Jersey Division of Consumer Affairs and Office of the Attorney General.
If you haven't heard about the program, it's not a new program. We've been around for a while, about 4 years now.
There is the Partner Director of Garfunkel Wild PC, Attorney at Law. He is Andrew Bluestein.
Successful defenses was, I said to the doctor, so he also had very aggressive patterns. What do you do? And he said, I wrote the textbook. He pulled that textbook.
And our final speaker for this first panel here, and then we'll open the floor up to Q&A, the Medical Director, New Jersey Board of Medical Examiners, Dr. Cindy Paul.
80% of patients who are on low-dose opioids account for about 20% of the overdoses. 10% of the patients who are getting high doses represent 40% of the opioid overdoses.
Let's open up the floor right now for a brief Q&A session. If you have a question that you would like to ask to one of our panelists, just step on up to the microphone. I talk into one every day. It won't bite you.
Am I still required to order unnecessary MRIs or this test or that test or send them to physical therapy when they tell me nothing works?
Technically, medically unnecessary. From my world, defending you, they're not unnecessary.
That's what I want to do, yes.
Absolutely no regulation of Suboxone, and it can be prescribed. You pay the doctor for that, and there's no monitoring of other drug usage in conjunction with that. And I'm wondering if there's any movement towards better monitoring of Suboxone.
Internet pharmacies come into play. Is there a movement for it? I don't know.
Break. Mr. Bluestein will call a recess, but we're just going to take a brief break here. Don't stray too far away. We'll come right back with our second discussion panel, the local perspective on the national epidemic of prescription drug abuse, and that comes up in just a few minutes. Thank you.
Take Jersey Central with Bert Baron with you every morning. Listen online at WCTCAM.com.